Hello and welcome to this training program today provided by the Notre Dame Maryland University School of Pharmacy. My name is Rod and I'm with my friend Arlene and we're talking to you today about overdose response and naloxone. So a little bit about what we'll be talking about today. So we'll talk about some statistics on overdose here in Maryland and why this is such a big issue here in Maryland and across the country. We'll tell you what opioids are and what an overdose is. Well, how to identify an overdose and who might be at risk for an overdose. And we'll talk to you about what is naloxone, how you give naloxone, and what to do with it after you may use it. And then we'll tell you about the 5 steps and how to respond to an overdose situation. Finally, we'll talk to you about the Good Samaritan laws that protect you should you be in this kind of situation, and then how you'd actually get naloxone. So statistics on overdose and death here in Maryland. If you look at the chart, you'll see prescription opioids. There's actually a lot of deaths to prescription opioids, but it stayed pretty steady over the past 10 years. And this is because of regulations from the DEA and other regulatory agencies. And since the medications are now harder to get from the doctor, people are turning to street drugs to get their opioids. So that's why you see a rise in heroin and fentanyl deaths. In total, 86% of all intoxication deaths were opioid related. And this is a wide problem here in Maryland, as well as across the country, which is why we're talking to you about naloxone today. So what is harm reduction? Naloxone is a form of harm reduction. So basically, we are trying to save lives. So it might be someone who's using street drugs and they're addicted to opioids, or it might be one of your family members who just got a dental procedure and then was given painkillers, opioids, for after that procedure, and if they accidentally take too many, then they overdose and they could die. So we're teaching everyone about naloxone at basically Maryland universities so that people are prepared because they may run into a situation where they're in the scenario where someone overdoses on an opiate. And we want you to be trained on naloxone so you can save those lives and people don't end up dying. So now Arlene is going to talk to you about what is an opioid and an overdose.
So what is an opioid? It's any drug that contains opioids or derivatives, could be natural or synthetic, and prescription medication or illegal drugs. For example, prescription opioids are oxycodone, heroin, or fentanyl. They can come in different formulations, for example, pill, capsule, powder, or liquid. So here in this table, they show you the different medication and opioids and their names. So for example, oxycodone, the brand name could be OxyContin or Percocet. The other name people can call Oxy. So the illegal opioids, so illicit producers could be synthetic drugs. Pill form look like prescription medication. Powder form look like similar to heroin. They can be mixed. For example, fentanyl plus heroin can be dealing in combination. Fentanyl is hundreds of times more potent than heroin. It's the new one called carfentanil. It's approved for veterinary medicine and is 10,000 times more potent than morphine. So what is an opioid overdose? So the opioid overdose happens with a toxic amount of the opioid, could be alone or mixed, overwhelm your body. What leads to death is the following. Is a respiratory failure, is a lack of sufficient oxygen on the blood, and that lead in the reduction of oxygen in different organs, and they can lead to coma or death. So identifying an overdose and who is at risk. So who is at risk for overdose? People with opioid dependence, in particular following reduced tolerance. For example, detoxification and people who are going to the detoxification program, releasing for incarceration or cessation program. People who inject opioids, people who use prescription opioid in high dose, for example, people who are receiving opioids for pain reduction. So an example of a cancer patient. People who are use opioid in combination with other sedation substance, or have full member of people who's poison or using opioid. Some signs and symptoms of an opioid overdose are shallow or slow or no breathing, loud snoring. They can have blue lips or fingers, clammy skin. They can look like passed out, very limp body, and unresponsive stimulation are very slow pulse. So now we're going to talk about naloxone dosing, administration, and disposal. So what is naloxone? Naloxone reverses the opioid overdose and restoring the breathing. No potential for abuse or getting high. No effect on someone who hasn't taken opioid. Some have minimal side effects and is safe in children and pregnant. Have different administration routes, for example, intramuscular, intranasal, or intravenous. The wear off is about 30 to 90 minutes, so usually an opioid wear off is more longer than an naloxone. So the important here is that naloxone is reduce the opioid overdose. So naloxone can be used intravenous or intranasal. So now we are going to show you the different naloxone products and how to use it.
This is our first naloxone product. It is called Narcan, and this is one of the ones that the police officers normally carry. It's an intranasal, so it goes in the nose, and it's a pretty easy to use product. So what we have here is you basically have the nasal device, and there's a cartridge that goes right in the bottom here. It should come already pre-assembled for you. It looks like that. And then to use this product, you basically push the plunger into one nose, and that's all there is to it. And if they didn't respond, then you can give a second dose. So that's the Narcan intranasal product. Another product we have is another intranasal. It's called the Amphistar, and it basically has 3 parts. So what's important to remember, this one is all the color caps come off, so color comes off. So we'll take this color cap off, this top one off. You'll see now there's a needle that gets exposed there. Take this purplish cap off. And then there's a rubber screw part that goes into the needle and screws in like that. So now that medication is loaded, and now there's the atomizer, or basically the part that gets inserted into the nose, and this screws onto the bottom, and it looks right like that, almost like a syringe. Now for this product, you'll push down on the top portion here, and you'll do half into one nostril, half into the other. And then this one would be finished. So this is the Amphistar product. The next one we have is called the Ezio Auto Injector. This one's cool because it talks to you. So after you remove this cap, it'll start talking.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard.
So the red safety guard's right here. We'll pull that right
If
off.
not ready to use, to inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
So here's the black end. We pretend this is the thigh.
To inject,
Push it in.
5, 4, 3, 2, 1. Injection complete.
And then that's done. That's all there is to this
This
one.
trainer may be reused for training purposes. Replace the red safety guard.
So that's the Ezio. It's a really easy device, but it's also a very expensive device, which we'll talk about a little bit later. And then the last thing we have is basically your traditional needle and syringe with a vial. We aren't going to draw up any today, but you basically get all the liquid out of this vial into the syringe and stick it into their outer thigh and push it all into the outer thigh. It can go through clothing or anything like that. It's just important that you draw all the liquid up and get as much into the thigh as possible, as quickly as possible.
Okay, now that we've shown you what the different naloxone products are, we're going to tell you how to respond to an overdose should you find yourself in that situation. So there are 5 steps you need to remember. The first is rouse and stimulate. You're going to try to wake the person up and make sure they're not just sleeping or something like that. Second, you're going to call 911, describe the situation, give them your address, and tell them what's going on. 3, you're going to give them the naloxone product that you have. 4, you're going to do further resuscitation or CPR or rescue breaths. And 5, you're going to care for the person, maybe putting them on their side in the recovery position and anything else to do until emergency medical team arrives. So now we're going to do a demonstration on how to do the 5 steps.
So now we're going to demonstrate the 5 steps for an overdose response. So step 1 is rouse and stimulate. So we're going to try to wake the person up to make sure they weren't sleeping and that this might actually be an overdose. So, hey, Charlie, are you okay? Wake up. And we see there's no response, so now we're concerned. So now we're going to go to step 2, which is call 911. We're going to pick up the phone, call 911, and then we're going to give them our address. So hello, emergency. My name is Rob. I've got a patient here on the floor that's unconscious and not breathing. Please send help to 4701 North Charles Street. Thank you. And at that point, the attendant might give you more information on what to do, but then you can also move to step 3, which is to give the naloxone. So have the nasal naloxone. We're going to go ahead and stick it in his nose, half into one nostril, half into the other, and that's done. Now, if we waited 2 to 3 minutes and it didn't work, then we can give another dose. But right now, we're going to say he's kind of working. So now we're going to go to step 4, which is rescue breaths. So for this, you actually put your mouth on his mouth, give 1 breath, 2 breaths, wait 5 seconds, and then give another breath. Now, if you know CPR, you could go ahead and give CPR, but only if you're CPR trained. So after the rescue breaths, which was step 4, we're going to go to step 5, which is caring for the person. So you want to put them in recovery position. So you'd actually turn the person over, and that's so they don't choke if they were to vomit or something as they wake up. So to review the 5 steps, we're going to rouse and stimulate, try to wake them up. We're going to step 2, call 911. Step 3, give the naloxone. Step 4, rescue breathing or CPR. And step 5, caring for the person in a recovery position.
Okay, now that we've done the demonstration on the 5 steps of how to respond to an opioid overdose, there's one last thing you need to remember to do. So after you give the naloxone, we ask that you call the Poison Control Center at 1-800-222-1222, or you can report it here to Notre Dame Maryland University. And we do this so we can track how much naloxone is being given and how lives are being saved as a result of this training program and others. So we can see if this is actually effective in preventing deaths or not. Now we're going to talk about some laws should you give naloxone that protect you. The first, let's say you're at a party and it's really crazy and people start doing drugs. Maybe you touch the drugs yourself or you watch someone do it and you're afraid to call 911 because you don't want anything to happen to you since you're in this area with all these drugs. So this first law protects you against that. Should you call 911 in an alcohol or drug-related medical emergency, you can't be arrested or prosecuted for basically having that drug, being around that drug, or needles or anything like that, or providing alcohol to minors. So basically this protects you in that situation because you want to get that person the help that they need as fast as possible. And the second law basically protects you should you give naloxone to somebody. It keeps you from getting sued. So whether or not they don't survive or they're just really unhappy with you afterwards because they have hospital bills or something like that, this law protects you from being sued by that person because you made a good faith effort to help them. Now that we've talked to you all about naloxone and opioid overdoses, we know you're super excited to get some, so we're going to tell you about how to get naloxone. So here in Maryland, we have a standing order, which means you can go to any pharmacy and ask for naloxone, and they will work with you to get it. It's important to note that many insurances will cover naloxone, so it will be very low cost to you if you have insurance. In other states, you can go to any licensed healthcare provider and ask for naloxone and get a prescription. Then you can take that prescription to your local pharmacy in that state and get the naloxone. And then there's also certain government and other entities that give naloxone, which you can find out on the internet. If you don't have insurance, here are some of the prices of these products. Now, if you have insurance, you're not going to be paying these products cost that you're showing here on the screen. You'll actually pay something much less, maybe $10, $20 for one of these, depending on what your insurance covers. So the Evzio auto injector, the one that talks to you, is about $4,000 to $6,000. Very, very expensive, but it's easy to use. And there's the IM vial, so the vial, needle, and syringe. That runs about $11. So more harder to use, more aimed for medical professionals, but it is also very cheap. So if you can handle that, it's a great cheap option, especially if you don't have insurance. Then there's the Narcan Easy to Use nasal spray. That's $140 for a 2-pack. Like I said, your insurance may cover that. And then there's the Amphastar nasal one, which you have to put together, and that runs about $41 for a single unit. So next we just have some additional resources for you. These are in case you're interested in learning more about naloxone or opioid overdoses and how you could play a key role in the community and perhaps address this issue and save lives. Again, this was the Overdose and Naloxone program provided by the Notre Dame Maryland University School of Pharmacy. Thank you so much for paying attention to this program today, and have a great day.